Hello, and welcome to AWCI's Convention and INTEX Expo Reconstructed. Today's presentation is Navigating Uncharted Waters, AWCI Safety Directors in COVID-19. I am Anne-Marie Silvatelli, AWCI's Director of Education, and I will be your host for today's presentation. Also joining me as co-host and moderator is Kris Williams, AWCI's Director of Membership. We have a poll question for attendees. So on your screen, you'll see our first poll question of the day to help us determine how many are in our audience. We'd like to know how many people are viewing this webinar today with you. Please click on your selection and then hit submit. Thank you. Before we start, a few housekeeping items. All attendees should be on mute during today's presentation. However, we ask that you please mute your phones or computer microphones as well to ensure that we keep a clear line for our presenters. Should you have a question at any time during today's broadcast, please submit it using the question box in your GoToMeeting dashboard. We'll have a brief Q&A at the end of our presentation as well, and we'll make every attempt to get all of your questions answered.
Thanks, Anne-Marie. This is Kris Williams, AWCI's Director of Membership. And before we introduce our panelists, a reminder that the information contained in this webinar and any related material is not intended to constitute legal advice or the rendering of legal, consulting, or other professional services of any kind. Users of these materials should not in any manner rely upon or construe the information or resource materials in these materials as legal or other professional advice and should not act or fail to act based upon the information in these materials without seeking the services of a competent legal or other professional. And I'd like to welcome our member panelists today, Ed Hanley, Matt Taylor, and Mike Hill. Ed's the Director of Safety for the Raymond Group, responsible for developing and implementing all elements of Raymond's safety program so as to maintain a safe and healthy work environment in both field and office operations. Ed has over 25 years of experience in the industry overseeing safety operations. Ed's also one of our co-chairs of AWCI's Safety Directors Committee. Matt Taylor is the Corporate Safety Director at OCP Contractors in Toledo, Ohio. With more than 27 years of experience, Matt's also an OSHA Inspector. Matt is the immediate past chair of AWCI's Safety Directors Committee. And last but not least, Mike Hill is Manager of Corporate Safety at PCI Performance Contracting Group and has been in the construction industry for 15 years. Mike is the new co-chair of AWCI's Safety Directors Committee. He's been with PCG for 15 years, for which he has been on both the operations and safety side. Having been on the operational side of the company has afforded him the ability to relate to the field and operations and to know that safety and productivity go hand in hand. Mike is passionate about safety and leadership. Gentlemen, welcome. We'll get started here. Our first question is directed to each of you. We'll kick this off with Ed, and then we'll follow up with Matt and then Mike. First question is, how is your company managing this situation? Is this your first crisis from a company standpoint, or have you had to lead through recessions, 9/11, whatnot? And what were you able to take from prior experiences, if any, and apply to this current unique situation? Ed?
Well, Kris, thank you. Falling back to past experiences is definitely something that we've done here at Raymond, and going through the recession and 9/11 and learning from those experiences are definitely what we're falling back on now. As we're able to guide through all of the information that we're learning through COVID-19 and this pandemic, understanding the information as it comes out, and it's coming out quickly, and disseminating that information properly to our teams is something we're really trying to focus on, and our executive staff really are helping filter that information out. So those are definitely some things that we're learning from, is using our past experience to understand information before we communicate it out to our teams.
And Matt?
Yeah, we developed a crisis management plan some years ago, and we've had to pull it off the shelf a couple times. The crisis management team, we brought that together immediately right away when it come to Ohio. and that consists of myself, HR, CEO, president, CFO, and we kind of manipulate that team depending on how big the crisis is. Of course, this took the whole team right away. We developed a plan calls for a debriefing each and every day. At the beginning of this, as you can imagine, as things were unfolding and changing on a almost hourly, minutely basis for us, we brought that team together, met each day. We all would break out, come up with plans, and then come back together and meet each day and give a debriefing. That lasted for about a week to a week and a half, and now we're then it switched to a almost weekly basis, and now that we've got plans in place, we're meeting less, but those debriefings happen, and of course, we're bringing in other people to those meetings now. And like Ed said, just making sure that the information's flowing in the right direction and everybody's in unison is a huge part.
Thanks, Matt. Mike?
Thanks, Chris. A lot of ours has been very similar to what both Ed and Matt are talking about. We've been entrenched with this as well as others during this time, applying procedures and protocols to sites and branches. We also began a task force meetings internally, and it was back shortly after Valentine's Day when we started realizing that this thing could become potentially out of control or get to the level that it is today. And then those meetings have continued. The frequency of the meetings were pretty much daily at that point, trying to get everything in place. But the frequency of those meetings have continued throughout this pandemic. To the point where we're meeting on a weekly basis now. As far as the leading through, recessions and 9/11, this is certainly the first pandemic I personally have led through. However, we've weathered many crises to date, and I think that, the transparency and everything that you show individuals and how you show up during this time is really key. Having a plan and communicating the plan, getting others involved early in the process, like Ed said, getting management personnel, getting your HR teams, everybody is really key, as they're all going to play key roles in this pandemic process. We've got a great team and leadership that's helping guide us through this, and identifying and focusing on your guiding principles as an organization and sticking to them has been a true testament during this time.
Thank you, Mike. This next question is, how different do construction sites look in a COVID-19 world from a safety director's perspective? And Ed, if you'll be the first to take this, please.
Sorry about that. Yes, from a safety director's perspective, with regard to COVID-19 and the policies and procedures that our teams are faced with, just the simple things of meeting out at the job site and having toolbox talks or having production meetings and breaking those down into the smaller groups that are required. From my perspective, I've seen the slowdown of maybe some production to increase the safety of the employees, of all the employees that are out at the job site, and those efforts that are done daily. So, there are more and more changes to come with job sites. As of late, we just got some additional updates from Cal OSHA that will affect the projects here in California, and how do those look from a safety standpoint, and how do we administer those? So I've seen some great things happening out at the job sites where people are really trying to make every effort to comply with the guidelines that are out there with COVID-19. So it's different for every job site, and so I don't want to make a blanket statement where it's all the same. So they do vary, but we are becoming more and more unified with some of these orders in Nevada and in California. So I know Mike can speak to to some of the other states. But California and Nevada are becoming more and more uniform, which is a good thing.
Thank you. And Ed, you brought up a good point about the Cal OSHA. So to all the attendees, in the handout section, we have a handout of the slides, but there's also a PDF for those of you in California from Cal OSHA. So Mike, what do construction sites look like for you, and what do team huddles, toolbox talks, et cetera, look like? Are you restricting these gatherings or adjusting to adhere to physical distancing requirements?
Yeah, absolutely. They look totally different than 3 months ago. So, we've been pushing a lot of the communications into the field at regular intervals, trying to keep, everybody out in the field abreast of some of the protocols that we put in place, and kind of alluding to what, along with what Ed said around, jurisdictional stuff. California has issued their own stuff. Oregon has issued theirs. The state of Washington has issued theirs. Where Matt is in Ohio, he can speak more to it, but we're seeing more jurisdictional stuff as far as regulating these meetings. But as far as meetings, in the field and how they look and what they consist of, we've been adhering to the 10 or no more people gathered, unless there's a more stringent guideline that has been enacted by a local jurisdiction. And then maintaining the 6 feet distance from each other. So that is 4 smaller group meetings. Where we may have had one toolbox talk with more people on site. We've had more individualized meetings, and there's been an unintended benefit with it, that they're more personal in those meetings. So there is a silver lining on some of that. But also, whenever possible, we're conducting the meetings outside of the building. So typically, it would be in the work area at the toolbox or at the gang box rather. But we're trying to get these things outside, open up fresh air, and then also there's more room. Meetings are not the only things that have had to adjust. We've had to stagger start times, lunch times, break times to allow and afford for the social distancing. It's also taking up more real estate, if you will, for these meetings. And so that's another reason for moving them to the exterior of the building.
Mike, thanks. Matt, this next question is for you. What challenges are you experiencing, or have you experienced any challenges in purchasing PPE, in particular respirators, and how are you dealing with that?
Yeah, so you can imagine, I imagine everybody in this room can imagine, we are thinking for a safety person has to be a month and a half out. Your suppliers and things, you had to start thinking outside the box. Respirators alone, how are you going to use your N95s? You want to make sure that you have them available for the tasks that you might be generating silica, and you got to save those for those tasks, because you're not going to get by with not using them there. So not only is about getting the orders in, but how do you preserve what you have? The challenges of the supply houses you're used to going to. One of the things that we just ran across was getting gaiters for everybody to come up with the mandatory face coverings that we're starting to see. That supply, we thought about it about a month ago, and we put those out there and got them out on order, and we got them in before they made it mandatory. But that didn't come from the online shopping. That didn't come from the safety stores. Where we did find it was with the person who was making our t-shirts. These people have that kind of stuff. And so thinking of different avenues to get some of this equipment, I really had to broaden out where I was looking. You're not finding it on the internet. And if you place the order, it could be, they're going to tell you it's going to be 2 weeks from now, which turns into a month, which may turn into a month and a half. So it is difficult finding it. And then on top of it, it's a matter of, does it work? So the gaiters, for instance, we're bringing gaiters, and that causes a problem of fogging up glasses. And so now you got to look at, well, do you need spoggles? Do you need, and so it's ever changing. So you order this stuff in and it may create a new problem, which puts you on another path of ordering different types of PPE. So it is an ever-changing world. All I can say is you can't expect anything overnight, and try thinking a month in advance.
And I'll follow up with you on this one, Matt. What effect, if any, has OSHA's relaxing of some of the respirator requirements in 1926, for example, allowing use of expired masks, permitting reuse, had on safety protocols on the job site? And just today, I saw that OSHA's issued interim guidance on reusing disposable N95 filtering face piece respirators for the healthcare industry that, in theory, would also apply to the construction site as well. Has that helped in terms of good faith efforts to provide face coverings, but also in the requirements themselves providing respirators when needed, or is that having a negative effect?
To be honest, we haven't experienced that right now because we've been really watching where and how we use the N95s. So it's that planning ahead. We had a good stock already, and right at the beginning, at the crisis, we started managing how are we going to supply these. Do we need them? Do we need to first stop? We had to stop the voluntary use kind of thing and say, okay, use this instead. So it was managing that PP at the very beginning that's put us in this avenue where we haven't experienced that. Maybe Mike or Ed can elaborate on that more, but we haven't ran into this as a problem yet because we started managing it right at the very beginning.
Yeah, I'd like to open that question up to first Mike and then Ed as well.
Yeah, absolutely. Thanks, Chris. Very similar to Matt's situation as far as the obtaining and the availability of PPE. It's forced us to look into different avenues, such as the net gaiters, just as Matt described, but some kind of CFC or cloth face covering, especially in many jurisdictions, and that varies vastly from where you're at. But OSHA has relaxed the respirator requirement, and they've also provided some guidelines. Those guidelines were a little slow to come out, but I'm glad that they're out, and they address the use of multi-day or expired use of N95s, and then also same-day usage of those disposable respirators, as well as some guidance on the use of respirators coming from other countries. So as we saw the depletion of the American stock of these devices, obviously looking elsewhere. And Matt made a great analogy. You're not just going to find these from shopping or surfing on the internet. They're few and far between coming in from other countries. There were a few manufacturers right off the bat that issued guidance based upon the different versions of a similar device to an N95. 3M had a great one that basically shows the comparison chart. The problem is some of those devices coming into the United States were getting held up at borders, and so that's where Matt was alluding to, that it's going to take a lot of, take some time. I think the month out is great, but you got to think month, 3 months, and continue to go down that path. It's helped the current crisis and allowed for the guidance and the usage of respirators in the workplace, but there has to be good faith effort shown by the employers, and OSHA has relied back to that. Their latest guidance came out, I believe, last week with regards to the good faith efforts by contractors. With regards to the fit testing, medical evaluations, and stuff of that nature, that is hard to come by at the current time, as a lot of these clinics have been converted into COVID clinics, or people just simply aren't going out to the clinics to have those evaluations right.
Ed, thoughts?
Thanks, Chris. Yeah, just to kind of follow up on what Mike and Matt just said, managing your inventory. We were fortunate also to kind of get out ahead of this as quickly as possible, and we also did have a fairly robust inventory before this started. So that those two things really helped. Getting out in front of it early and having a good supply before this hit really helped. get us out ahead of this. But we saw the same things everybody else did with supply chains being broken, looking for alternative supply chains to replenish stock. And then I think one of the important things that we did, as I'm sure most of you did out there, is we really looked to manage what we had effectively, so that it wasn't being overused or misused. And then, getting the guidance as Mike mentioned from OSHA, helping relax some of those requirements that were out there has really helped. Finding some of this additional information on face coverings and homemade face coverings, and having all these different jurisdictional guidelines from the different health departments for each county. And this is more respective to California's challenges, where based on the project where you were at or where your employees were living and had to travel to, those jurisdictional requirements were difficult, and making sure our employees had the right protections that they needed based on where they were living and or working were other things that we had to manage also. But we're continuing that effort, and with clarity from OSHA and from the states, it's becoming a little bit, I don't want to say easier to manage, but at least we have some direction.
And Ed, we'll stick with you, and we'll get Matt and Mike's input as well. But Ed, this next question, hot topic question, with so many different state jurisdictional requirements defining if construction is essential, if it's shut down and whatnot. Going to OSHA, have you seen any change in the frequency of OSHA inspections on your job sites due to the pandemic? And if so, are the COSHOs placing any emphasis on COVID-19 related issues like physical distancing, placement of sanitary products, face coverings, et cetera? And are they using it under the general duty clause with that emphasis? Ed?
Thanks, Chris. Yeah, I have seen and heard, so seen directly within Raymond projects, but also heard throughout the industry that OSHA is taking an active presence with regard to COVID-19. Sometimes their active presence is not always seen. Sometimes they are. Sometimes they're outside of a project. They're using long-range cameras to take pictures of employees out at projects, and looking for all COVID-19 guidelines that they're trying to trying to identify if they're being followed or not. But the one I'm seeing the most that they're looking at is the social distancing, looking to see if employees are really practicing that guideline of keeping that 6-foot separation. I have seen several of those come out, and then those inspections, turning into investigations, and then kind of driving that point home of following the guidelines that are there. And I don't see it slowing down, not for the foreseeable future. And it's something we need to prepare ourselves for, that this could be the new norm, that we really have to educate and coach and teach and mentor our employees to follow these guidelines. So it's protecting themselves, but it also protects us from an OSHA citation down the road.
Matt, your thoughts?
I think this is a good topic. Is OSHA relaxing? I don't feel they are. And as a matter of fact, we can get wrapped up so much into the COVID thing that we've got to make sure that we don't relax on the other things, as fall protection and silica and ladder use and all the other things that are right there all the time. We can get so wrapped up into the COVID that we may start to relax on some of that other stuff because we're so engrossed. So I just want to be careful as a safety person that we don't lose focus of all those other things that OSHA looks at and have been looking at for years. Fall protection still remains up top as the #1 cited hazard and leading cause of death in our industry. And we just need to ensure that we don't relax in this process of those things.
And Mike.
Absolutely. You know, OSHA, as we've seen it, has remained prevalent in many areas across the country during this time. They have shifted that focus towards the visible things, such as what Matt, or rather Ed, was alluding to about social distancing. There's some regions that they've been more active and more focused on the COVID protocols, but the job site and each company has in place. They're also inundated with this, so they're in the same boat as a lot of us contractors with complaints, et cetera. Oregon OSHA, for example, had record number of complaints received the first day that the guidance was released from their governor. And so they're trying to filter through that stuff, maintain and keep employees safe just as well as we are. And they're trying to help us protect that workforce. As far as the compliance officers, you know, they're placing that heightened awareness, as Ed mentioned, on the visible protocols, so sanitation facilities, social distancing, and then also they're taking a look at guidance as issued either by the CDC, municipalities, city, or local governments. There are a few standards that apply during this time as a pandemic plan, but there's not a standard to point back to, one standard. So a lot of it I see could be working towards a general duty clause. But we haven't seen any issuance of citations or heard of any citations being issued regarding the general duty clause at this time.
Thanks, Mike. I have a follow-up question here, and we'll go back around the horn. I'll start with you. One of the byproducts of some of the rules and regulations issued by states and jurisdictions has been an increase in enforcement activities by state and local health departments. We've heard things about them shutting down job sites because of failure to abide by social distancing, for example. Could you talk about any of your experiences, if you had them, and what you've heard about this new enforcement from this side of the house, so to speak?
Yeah, absolutely. You know, hey, many of the jurisdictions are relying a lot on county health departments and building inspectors to kind of help enforce the codes or the protocols that are out and in place. You know, as for us and many of these job sites, there have been some of the building inspectors coming out to the projects, mainly in the California area, that we saw some of this. But it's brought more assistance to the OSHA and their efforts for compliance, as well as a stronger stance from the agencies. Like you said, they can actually shut the projects down. And I've been even aware of a few discussions around health departments shutting down projects due to non-compliance, and also in extreme circumstances enlisting the utilities to get the utilities shut off to those places of business that are not compliant. So I think that it's a one step above, and they're trying to help OSHA go through some of these compliance issues. But I think everybody's inundated with this right now, and trying to figure out what that new norm is and seeing how they enforce it moving forward.
Matt, then Ed.
Yeah, I agree with what Mike just said there. It is the health departments that in Ohio, you know, we have our governor on each and every day, who reinstates that if employers are not following the guidelines set forth by our state health department, that they will come in and inspect, and they will shut down operations and possibly an entire company if a company is not following those protocols. I have not seen any or heard of any on construction, but they have done it on other industries, showing that they will come out and do this. So the health departments definitely have picked up here in Ohio, and we lean on them heavily for the guidance.
Ed?
And really just going to echo what Matt and Mike just said. Haven't seen any of the projects shut down because of non-compliance as of yet, but have heard many discussions and directly from some of the general contractors who are hearing from the health departments, from OSHA directly, that should they not tighten up what they're doing for the various different reasons that are out there on projects, that they could be subject to shutting the project down until the issues were taken care of. And I think there was something else to note also that we heard that could be happening in other areas, that the local health departments were not staffed to have people go out and do inspections of projects, just in the sheer numbers, and they were utilizing resources that were made available to them, and some of those regions were using the building department and the building inspectors who are already out at construction projects, and gave them some directive to report back if they saw issues with non-compliance regarding COVID-19 guidelines. So just something else to note with that also.
Thanks, guys. Ann, I'll turn it over to you.
Okay, and Ed, we're gonna keep you talking there. So we've heard from contractors a lot about staggering start times on the job site for the different trades. Is there a decrease in employees on the job sites to help mitigate potential exposure?
Thanks, Anne-Marie. I can definitely tell you that not only have we heard about contractors staggering start times, or maybe even limiting the number of employees on a job site to increase social distancing, we're definitely seeing it. And not all contractors are taking that approach, but I have seen several that have no other option, and they're forcing the subcontractors to do that, to comply, and it has a ripple effect of doing that, and yes, it helps increase social distancing, but it also makes it a little more difficult to meet schedules and project demands, and so it's a balancing act to do that. But we are seeing more and more requirements for staggering start times, reduction of employees on the projects to help create more social distancing.
Thank you. And Matt, what about what you're seeing and observing with job sites, and any decrease in the employees?
Yes, probably more so by not design. As you can imagine, I'm sure everybody's seeing the same thing of employees not coming to the site. But I do think you're going to start seeing this as we start to reopen. Here in Ohio, we just recently seen some stuff come from the governor on the reopening plan, talking about 50% of occupancy, no more than that. And I think you're going to have to pay attention to how we your own specific area of how they reopen, and what does that say, and how do you implement that. The staggering start times, we really have not seen that here, although it is staggered in that we're taking temperatures now, and it does slow how that process and how people get onto sites. There is a big difference there. The 6-foot distancing in itself limits the movement on the job site and where people are at different times. So the decrease of the employees, I think by nature it happened, but there's a lot of other controls that are mitigating that potential exposure as well. But really pay attention to the reopenings in your area.
Thank you. Mike, what additional health and safety procedures do you see GCs implementing on projects?
Yeah, Anne-Marie, this varies depending on the different GCs. As protocols and procedures vary upon GCs, we're seeing that same thing hold through with some of the COVID protocols that are being enacted. There's been guidance ranging, from your standard PPE or the social distancing from the CDC protocols on, social distancing, personal hygiene, sanitation, to more stringent protocols. We've had anything like from questionnaires, as Matt mentioned, they're starting temperature checks. There's some GCs that are having those as soon as you come in the gate, and that every subcontractor would be required to do that. Cloth face coverings has been a big one since the CDC issued the guidance around everybody should be wearing something out in the public. So we've seen an uptick in that. Limiting crew sizes, isolation rooms, one-way foot traffic / stairwells. So, you know, like some of the up and down on a project. We've also seen limiting of use of elevators or man lifts that have been out on the projects. Vehicle restrictions, delivery restrictions, and it kind of goes on from there. It just varies depending on who you're talking to and what GC you're doing work for. Hey, if there's a silver lining in all of this, it also helped with the ever-present trade stacking that we all deal with, as the social distancing and being able to actually work in your room or finish an area. It has helped with that. There's also some new COVID prequals that are coming out recently from some general contractors. So when you look at the pre-qualification process, you or your company may experience going through a pre-qualification. Now there's an additional layer that some of these GCs are implementing. And we started seeing that as of last week, some of the COVID prequals that are coming out from these general contractors. But this landscape continues to evolve, as does the disease and construction activities either coming back or ramping up as we work our way through this.
Thank you, Mike. And Kris, I'll turn it over to you.
Thanks, Anne-Marie. Mike, we'll stick with you on this one. Due to the COVID-19 outbreak, are you creating or implementing an infectious disease outbreak response plan, if you have one in place, or developing future scenarios that could impact your business? And has this led you to create and update any relevant policies such as remote work, travel to and from the job site, visitor guest entry at the office or job site, additional training for employees, things like that?
Absolutely. Thanks, Kris. Yeah, so we've had a pandemic response plan for some time, but this pandemic, however, with the COVID-19 has led us to revisions and strengthening of our current programs. As far as it relates to future scenarios that could impact our business, I feel this pandemic has challenged everyone to focus on many different aspects that they may or may not have in their own program, and it forced us to think outside of the box into other areas that we could get even stronger. The what if scenario has been put to the test with this current pandemic and forced us to think further and more vastly about what could happen. And it's not a matter of if, it's a matter of when. It's allowed us to create and update relevant policies. Absolutely. We've been bolstering our programs ever since we started the COVID meetings back in middle of February. And as far as different areas of remote work, travel to job sites, visitor guest entry, a lot of that's going to be coming down the pipe, more so with as different jurisdictions open up. But as I mentioned earlier, it's key to get all the folks involved from the start. Our HR benefits team, legal, safety, risk, work comp, we all have been part of this COVID task force. And I guess the other thing is if you haven't set that up or enacted those people, it's not too late to have that task force developed. That I feel we're very fortunate to have some really talented folks on our side that have assisted throughout this thing. We are continually in the process of reviewing, developing, revising plans as the landscape continues to change.
And Ed, your thoughts?
Thanks, Kris. Yes, as we all work towards whatever this new normal ends up being, the COVID-19 plan that we've implemented has gone through many different changes and volumes, as we've also tried to keep up with the changes as Mike was talking about, and that's really been a challenge, but we were able to meet the challenge with our task force as well, and having everybody's input so we can stay up to speed was a testament to the whole team. As Mike mentioned, getting people's engagement in this conversation and the key people, the right people, is important, and it definitely isn't too late to start it. If you haven't already implemented that task force or that plan, whatever you want to name it, it's not too late to do. It's definitely something I encourage you to look into and start if you haven't. But with respect to how this has made us look at these challenges differently, distance working is definitely something that is is something that is going to be in the foreseeable future, and how you approach that, and not just provide that as an opportunity for the employees that can distance work, but how does the manager now manage those employees who maybe that wasn't a normal practice in the past, and implementing measures to make sure you're staying engaged with your team, and also providing them an opportunity to stay productive by distance working. And the other thing we've looked at with our COVID-19 plan is as we work towards this new normal and reopening business, is these guidelines affecting the office, and the same guidelines that we're following in the field pertain to the office, and looking at how we're going to create social distancing there, and what do the new break areas look like. Obviously those things need to be addressed, and so everyone can have an understanding. And that's where I think the training falls in, and building a good comprehensive training program that you can educate your employees, office and field, is extremely important, and making sure it's updated and documented. If it's not just because you're talking about it, if it's not documented, it never happens. So training is also extremely important.
Thanks, Ed. And you talked about distance working. It was a great segue into my next question for all three of you. And Ed, we'll start with you and then go to Matt and Mike. With the pandemic affecting all facets of a firm's operations, have you found yourselves essentially expanding your safety and health responsibilities into HR and remote work situations? And interestingly enough, what new equipment have you had to invest in because of this pandemic?
Thanks, Chris. Definitely our responsibilities have expanded, but relying on our task force, our COVID team has been a huge help. So assisting where help is needed, whether it's HR, whether it's operations, or even additional questions about safety and coaching the team. All of those facets, I think, are areas where we've been asked to help. For referencing operations, with I think Mike talked about it a little bit about finding out what the cost of doing business is with respect to COVID-19, and addressing those costs, and having good solid information we can give to your project team for current projects and future projects, for estimating change orders, things like that, and then on the HR side about just helping understand, making sure that the ADA regs that are out there, and HIPAA laws that are out there, that with the pandemic being out there, and I know certain things are relaxed because we're in a pandemic, but there are still guidelines and rules that we have to follow with that, and making sure we're educating ourselves and our employees about those are important. And then with respect to new equipment we've had to buy, I know really leaning on our IT team to provide all the additional computers and the hardware side of things. So distance learning is a possibility, and some software I think we've looked into to help connect the team with video conferences and the like. And so there definitely has been some additional equipment and software purchased to help provide us that opportunity.
Thanks, Ed. Matt, your thoughts?
Yes, I gotta imagine there's some that aren't as fortunate as I am. It wasn't too many years ago that we did not have an HR department. And I imagine there are some people in this arena right now that are juggling just that, and having an understanding of what the House Bill 6201 brought to everybody, and how do you juggle that into the safety program. We are fortunate enough that we do not have an HR department, and we're working with that individual and helping them do the tracing of a potential case, and understanding who else may be affected. So dividing those duties up and being able to do that safety inspection when you hear something potentially on your job, what else needs to be done, and how does that affect the others around? That's an expansion. The taking back over the ordering of PPE. Talked about that a little bit earlier, and ordering that equipment where maybe we've let go of that to another department, you kind of bring that back because it's not as easy to find. And cleaners, you know, the idea of running out and picking up cleaners never really was a safety position, but now it has become one of where do you find your disinfectants? You know, we've been successful in getting into our rural areas and going to the Family Dollars and picking them up there because you're not just able to order them out online. All those things have added extra duties in which, you know, that normal safety world didn't have before. My heart does go out to those who are trying to juggle the HR and safety at the same time. I can just imagine how difficult that is, but don't be afraid to ask for help. You know, develop a team that you're starting to shed some of that responsibility into picking up that equipment. If you find yourself trying to do too much, you can become overwhelmed if you're wearing too many hats. And I would just encourage that people look for that. As far as investment into new equipment, yeah, I mean, you're looking at how are you going to, in your voluntary use program, what are you going to switch over to? We became inventors. We were lucky to get our hands on gaiters, but early on we were trying to think, okay, how can we make a face piece? What does that look like? We took short sleeve t-shirts and cut the arm sleeves off and used the short sleeve as a mask. It was something that could get us by. So becoming inventors and trying to think, okay, I can't get this equipment, but what can I do right now? I mean, I had a couple of our t-shirts cut 3,000 ways to try and figure out coming up with a face piece. So yeah, there are expansions of what we're doing, no doubt.
Thanks, Matt. Mike, any thoughts?
Yeah, I think, you know, coinciding with both Ed and Matt, you know, it's a total team approach that it's necessary for this whole thing. We found success, you know, with some of the technology and platforms that Ed was talking about, you know, IT getting involved and getting people set up in remote workstations, stuff of that nature. But ultimately, our task force has been able to remain connected, even though we're, you know, working from home. We've been able to remain connected and continue, and sometimes that frequency of those meetings has been, I guess, more meaningful as we are direct face-to-face with a lot of the technology that we have. As far as the equipment, for certain, I would have never guessed that 4 months into 2020 or in 2020, for that matter, that thermometers would have been a commodity and that it would be prevalent in the construction workforce and be part of a safety director's lingo. But that has been something that has been part of the procurement for some of our job sites and office facilities as we look at the different jurisdictions and what they're requiring as people move in the spaces and get back to work. Net gaiters, surgical masks, hand sanitizer, temporary wash stations. I mean, the list can go on as far as what we've had to, I guess, venture out into. But along with this has been broaden our horizons on procuring materials and equipment, and also thinking outside the box in many facets. You know, we even had a few of our branch locations convert to sewing masks for first responders, medical professionals, and ultimately our field. So, you know, as Matt said, I think there's a lot of ingenuity. There's a lot of smart people we have in the field that will figure out this social distancing, different ideas that we can come up with to comply with the standards.
Thanks, guys. Next question here is, have you noticed a heightened awareness of safety on the job site from your workers, and has that resulted in a decrease in incidents or near misses? Or on the flip side, has there been a negative effect on reporting? Mike, I'll go back to you on this one first.
Yeah, absolutely. I think that there's initially there's a lot of anxiety amongst our teams, and I think it's a normal human behavior when you deal with the unknown. And when something's not known or it's not present in front of you, it's also normal when all the restrictions have been placed upon you, or forced down upon you. So I think there was a lot of anxiety, but we've been able to see some improvement or ease some of that anxiety by communicating our plan and taking action. When people see, when our employees see you taking action on your plan, having a plan in place, and then being transparent, the anxiety starts to subside. Will it ever totally go away? Who knows? But being transparent, communicating a clear message has really helped for our organization. On the flip side, as far as injuries or heightened awareness on the job site, I do feel like there's been a heightened focus and attention to detail that has been brought to light, whether it's employees focusing on maintaining the social distancing, not having as many people to work around, as far as trade stacking. There's a lot of that kind of stuff that has led to, I feel, some of the heightened awareness out on the job sites. I think it's too soon to tell if there will be a negative effect on reporting or if there are some incidents going unreported. But we've seen some pretty good success with some of the protocols we've put in place. And I think a lot of it is the attention to detail and the intentionality of our employees.
Matt?
Yeah, exactly what Mike said. I think the anxiety can be a positive. I think it does heighten the awareness of the employees. But looking on the flip side, yes, we've seen a decrease in injuries, and I'm skeptical, just like Mike said. But if we think about why that may be, there's a lot of positives that came from this. Our job sites have never been cleaner. There's no doubt about it. Employees are taking more proper care of the tools and equipment. The trade stacking, you're not having to fight around other trades. And so a lot of those hazards are being removed just because of the 6-foot distancing and the heightened awareness of what we're doing. The focus is really driven right now with the average employee, and I think there are some positive results coming from this. But like Mike said, I think we'll have to sit back and wait and see if this trend continues. So yeah.
Ed?
Thanks, Chris. With respect to anxiety, I'm going to really echo what Mike and Matt what they just finished sharing with everyone. I think it's a natural human behavior, and I can't remember which one of them said. I think it was Mike, but he's right. Having good communication about what the hazard is, and good education of the employees, or to the employees of how to protect themselves. And that really goes with any hazard, but really with this one, you want to kind of get out in front of it and make them show them that you are doing everything within your power to protect them while they're at work. And we did see that also, and there was an definite united effort to get out at the projects and talk and educate with the teams about what we're doing and how we're going to be doing it and what our approach is. But we also make sure to talk to the employees about taking ownership of their safety, and keeping these projects open will really be a direct effect of them following the guidelines that are there. We can only coach and educate and show them the plan, but they have to follow it. And with that united effort, we're going to keep these projects open and provide them an opportunity to continue making an income where, there's thousands and thousands of people that are sitting at home because they're not deemed essential, and they're not afforded an opportunity to make an income. And that was some of the messaging that we talked to our employees about to really get them to see and ask questions and understand what the plan was. And I think both Matt and Mike said it best, that it has had a positive effect at our job sites. I can't tell you how often or how clean I've seen these job sites, and with all the sanitization that's going on and have equipment and tools constantly throughout the day. Those are really, really good things to see. And Mike's right. I think it's a little too early to tell if it's going to have a negative effect. I have seen, I'll agree with you, I have seen a reduction in incident reporting Is that because there's a super high focus on safety and COVID in general, and they're just not happening? I think it's too early to tell exactly. I think I think we have seen maybe a few suspect injuries or claims that maybe will regard with were a direct effect of anxiety. Some employees maybe not wanting to be at the job site because they just had fear of that, and I'm sure everyone's seen a few of those. But overall, I definitely think it's had a positive effect with regard to keeping the job sites clean, and we'll have to wait and see, the next few months ahead of how it's going to affect our reporting down the road.
Thanks, guys. Anne-Marie?
Thank you. This one will, quick question, will go Mike, Matt, and then Ed. So the federal government is leading the response to COVID-19. However, states and municipalities are building their own responses to the pandemic based on their local needs. So what websites are you clicking at before you begin your workday, or when you do? For example, since some of you have work across state lines, are you going to Council of State Governments for executive orders by those states, CDC and such? So again, Mike, then Matt, and Ed.
Yeah, thanks, Anne-Marie. A lot of ours has been, my daily check is, the AGC's been putting out a lot of stuff. So the local AGC chapters, they've been a huge proponent of construction throughout this pandemic. So they've issued a lot of different guidance in a lot of different jurisdictions that has really helped. Your standard OSHA, your OSHA state plan, state stuff, county health departments have been a key one as well. Subscribing to the OSHA quick takes has really helped. That pushes a lot of information your way. And then also, thinking outside the box and relying on work comp carriers have actually done a real good job of putting together some of the restrictions and some of the early developments and latest developments, for that matter, that are out there. So those are kind of the key ones that I hit on.
Okay, thank you. Matt?
I agree with everything Mike said. The only thing that I do a little bit different is I begin my day each morning by opening my email. And that is part of just making sure everybody is putting in their health check that day. And I then open up my safety software system where they're reporting all that and see if everybody's clear to come to work. And then it's a call to HR of those who are reporting in sick and start the process there of the inspection. I stick with the governor orders. I tend to end my day with the state governor because he does his briefing, and any changes that are going to happen, it happens then. And it's weird that my day kind of consists of really, really busy from about 5:30 in the morning till 9:30 in the morning, and then I get a little bit of break, and then it takes off again as soon as that governor order kicks out, and really making changes to what takes place throughout the day. I would agree that the CDC has been on the money. It's a great place to look. And along with OSHA and all they're having to offer there as well. But the health departments is another place I frequently visit just to make sure we're staying in line with that.
Thank you. And Ed?
Thanks, Anne-Marie. Yeah, just echoing every single one of those things that Matt and Mike just shared. I think ours has changed a little bit throughout the process. I know in the very, very beginning, we were really hyper focused on CDC and the local county health departments because they were different based on where we were operating, and so we were really looking into those. But then it became almost a chess match between who was going to outdo who, and the mayor was putting out an order, and then the governor was putting out an order, and so we're checking all of those constantly now. But I would add in the mayors to that. The mayors were putting in orders respective to their areas also.
Thank you. So what I do want to get through a couple of the attendee questions first here. So one of them is coming in from a distributor, and they are asking, what delivery guidelines can I expect to see or prepare for? So Mike, if you want to kick us off with some thoughts on that.
Yeah, absolutely. I think it's going to be difficult to say one set of guidelines, but I guarantee you need to check with whoever you're delivering that information or delivering that product to. So check with your customer and see what they have on site. As we spoke about earlier on in this webinar, it varies from site to site. There are some sites where you can't even get out of the truck. There's some sites that there's certain protocols that are in place if you do get outside of the delivery vehicle. So I think your best resource would be getting with the contractor that you're delivering for, or fully understanding what's expected of your drivers as they get that materials to site.
Okay, thank you. And Ed or Matt, do you have anything to add to that of from what Mike shared on his experience?
I don't, Mike. You nailed it. Just got to do some really good pre-planning before you leave your place of business for your delivery.
I'll ditto those statements.
Thank you. So our next question coming in is regarding social distancing. If social distancing cannot be maintained, a risk assessment is to be performed to determine what other measures can be taken. Can you please provide an example of controls or alternatives to social distancing that can be taken?
I'll take that one. Yeah, we've actually created a policy that requires the safety directors or regional safety managers and the superintendents to meet and create a JSA for a task in which social distancing can occur. Some of that is one great example for what we do is hanging ceilings. And how do we approach that? And it's kind of bumping up what you already have. We require face shields at that time. N95s may be appropriate if you need 3 people. Working in a lift together, 2 people, you're definitely going to be within 6 feet. Another place that you're going to have to do that. And you're just going to, the requirement is to increase your disinfecting efforts, washing of the hands, all those things that we already have in place. You almost have to double up in those procedures. There are tasks out there that we do day in and day out that puts us closer than 6 feet. But once again, you have to look at, is it required right now? Are there alternative means? Can you find another way to do this? And it's really created an environment of lean thinking. I think another positive that's came from this is getting our field members involved to say, is there a way we can do this by ourselves? Which ultimately creates a type of lean thinking out there. We're being surprised by some of the stuff that we're able to find out another way of doing it. And so I think another positive came out of this is lean.
Thank you, Matt. Ed and Mike, do you have anything to share on, expand on that?
I do not. I really just ditto what Matt said there, and lots of good things are coming out of just having different perspectives on the challenge, right? Different way to accomplish the goal, and I think that's the good thing. I think one of our executives shared this comment. I'll share with everyone that we have to look at ways to find the silver lining in everything that we're doing. And if we do that, we will become better because of it.
Absolutely agree. So thank you. And with that, that covers the questions that came in so far, and I will turn this over to Kris.
Gentlemen, thank you for taking the time out today. I know we're a little bit over, so we'll wrap up with our final question here. It'll be for all three of you. We'll start with Matt and then go to Mike and Ed. We've talked a lot in this webinar about short-term realities from a safety standpoint related to this pandemic. Do you have any long-term thoughts that you'd like to share with our audience about where we're headed in the new normal?
Right now, my way of thinking is we're here, and I don't see it going away anytime soon. I think we're here until we find a cure, or there is an antibody, a way of treating people to make them healthy. I think the things we're putting in place now, there's going to be a place for this in the future. I hope there will come a day where we can get back to some of the stuff, that the reality of not having to live like this. But in the near future, for the safety people, I think that the idea of virtual inspections, the idea of virtual meetings, the idea of virtual training, bringing out a virtual 30-hour, all those things are things that we're going to have to bring to the table and be ready to roll as if this is our new future, at least for the next 6 months. I hope it's less than that, but my gut feeling is that we're going to be here for quite some time.
Mike, thoughts?
Yeah, I think so. You know, some of the stuff is, you know, never think the impossible is impossible. You know, like I said, you know, who would have thought 4 months in, 3 months into 2020, we'd be this far entrenched with this. But I think also we have some extremely talented employees that work for each of our organizations, and you know, given the opportunity, they're going to find and develop great solutions. You know, kind of going back to the comment around what you know, how do we work within 6 feet and stuff of that nature that came in. You know, a lot of that stuff is going to naturally occur. Whether it lasts 6, 12, 18 plus months, God forbid longer. You know, there's always going to be an opportunity to dive in to your program and strengthen them. Also, you know, lasting effects, like how you show up as a company, as a person, as an individual, and respond to a crisis will have lasting results.
And Ed, we'll wrap up with you.
I agree both with Mike and Matt, that with what they said. You know, what is our new normal? And I just wanted to add this to their comments, that, you know, I don't think we really truly know what the new normal is. I think we are, as Matt said, we're kind of working through it right now. But I think we've learned a lot. I think there's lots of processes and protocols that we've learned that beyond a vaccine being found and being administered out to the public, I think there's still some of these things we've learned that are probably going to stick around beyond the vaccine. And I think that's really what the new normal will be. We just don't know what that is yet. But being prepared, being creative, and being optimistic when in the event of a crisis situation is what we all have to do. And I do think we're doing that. So that's all I've got to share.
Okay, well, thank you, everyone. And on behalf of AWCI, we'd like to thank the attendees and our panelists in joining us for today's AWCI's convention and INTEX Expo Reconstructed. As a reminder, this program was recorded, and you'll receive a link to AWCI's online program library following the conclusion of today's broadcast. And be on the lookout for our weekly Friday emails with details about upcoming AWCI convention and INTEX Expo Reconstructed events running through May 12th. So stay well and stay safe. Thank you, everybody.